I titled my talk, I know this is going to be focused on memory issues in the elderly and how to prepare, but I thought to broaden the scope a little bit to understand, to help us all understand aging and how it relates to mental health, then dive specifically into memory issues. Okay, so the focus of my talk is going to be a little bit on what is aging, and then memory issues in the elderly and early signs, reduction, and how individuals can prepare and respond with confidence in themselves and for any elderly loved ones that they have in their lives. Caveat that this is not meant to be comprehensive. So if there are any questions, I can definitely go into further detail as best as I can. Okay, so first off, I'm sure everybody wants to know exactly what is aging. We all experience it, and we know what comes at the end of it, but what does it involve, right? Okay, so there are actually two aspects of aging that people should understand. One is the physical aspect, the physical impact of aging, and the other aspect is the cognitive impact of aging. So I'll focus on the physical first. And actually, these things would be quite obvious to you. First of all, aging is a very natural and physical process which involves decreased functioning over time. And as to exactly when, how old, what happens, all that, there's a lot of information out there, but the broad scope of it, there is decreased physical functioning. There is also naturally an increased risk of disease and the development of common health issues. And in Singapore, a lot of it is things like hypertension, high cholesterol, diabetes, heart issues. All of these changes actually mean there are also changes to our brain, which has a direct impact on our memory and our ability to perform tasks that may have been easy for us before, and then become not so straightforward as we grow older. So then the psychological impact of aging. So this is slightly different from the cognitive impact. What I mean by the psychological impact is all these changes, what does it mean for us individually when it happens? So the changes to our appearance is one major aspect of what happens when we age. There is naturally also a corresponding reduction in fitness, stamina, and our sexual health. Naturally, the other thing that happens is a lot of us start taking chronic medications. Hospitalizations become a very real part of our lives. Anyone who has reached a certain age and doesn't need chronic medications, hasn't been hospitalized, is truly blessed. And I have encountered a few people like that, but the vast majority have at a certain age encountered all of these things already. Then there's also the impact of being replaced or retired at work. And this is a reality that all societies face, especially Singapore, where we have an aging population, and what to do with people as they hit a certain age. And then as we grow older, naturally, our circle of support grows smaller because our children grow up, they move out, they may even leave the country, and our friends pass on as well. All of this means that there is a direct impact on our lifestyle, our level of independence, confidence, and self-esteem. Because fundamentally what it is grappling with a series of losses, which lead to a sense of uncertainty. And then, of course, we have to prepare for the inevitable, leaving a legacy, or if there are some people who don't have a legacy to leave, then that's what they have to prepare for as well. So I put this little diagram up. This one is taken from the internet. Erickson was a psychologist who basically broke up life into different stages, and I just want to focus on the the very last of the 8 stages of development, where at a certain age, what people grapple with is the meaning of their lives. Looking back on it, they're not really focused on productivity, not focusing so much on relationships anymore. These are the questions. They're more reflective and also more wisdom. So the saying or the thing about having a senior who is very wise, little bits of treasure, and information that you can get from them. This is all very true. Okay, so fundamentally, aging consists of physical and cognitive decline, as well as social changes. These results in reduced physical activity, engagement, and social interactions. And the other thing that complicates all of this is older people and even us younger people having to adapt to a very increasingly digital world and all the other rapid changes that we have to keep up with, which grow increasingly difficult with age. And then all of this naturally leads to a heightened sense of isolation and loneliness, which leads to higher psychological distress. Okay, so then this is the context. Now I come specifically to memory issues in the elderly. Okay, so there is a difference between what is part of normal aging versus what is a little bit more on the abnormal side. So I focus on what is more normal. If you remember earlier in my first few slides, I talked about changes in the brain being something to be expected. So therefore, how it translates day to day is it is normal to forget occasionally. It is normal to forget specific details. Don't even talk about elderly. I also forget things, right? So as we grow older, it is expected that we might be a little bit more forgetful. And the important thing is the person who is forgetting is still self-aware. They know that, oh, I forgot this. And then the minor lapses are later corrected by the person or they are recalled accurately. Like, there and then I cannot recall this person's name. But if I think very hard, 5 minutes later, I remembered this person's name. And fundamentally, this type of normal forgetfulness shouldn't interfere with a person's daily life or functioning. They should still be able to drive, go buy their groceries, take public transport, use their phone, use their banking, go to the bank or use their banking app, etc. On the other hand, dementia, which is a very broad term, medically speaking, but I just use this term first, actually describes a progressive neurodegenerative condition, which means that there are brain changes that result in shrinkage or degeneration. And it's characterized by cognitive, which is memory, and functional declines, which is the day-to-day stuff that a person can do. Oftentimes, sadly, the recognition of the condition is by people external to the person, so family and loved ones, and unfortunately, it is not by the person themselves. So this is the important question. How can I tell if my grandparent or my parent has memory issues? So here are some clues. Okay, so again, this is not comprehensive and it doesn't mean if there's just one, you start worrying. It has to be in the context of a few things, and that's why we do a clinical assessment. But some clues would be, if they start to forget more recent events, long-term events doesn't count. The brain's ability to hold on to memories from long, long ago is remarkable. But more recent things, because of the way the brain works, are things that people forget. So a misconception I often find when families come to me is, no, they're not forgetful. They can remember what happened in their childhood. It's just that recently they cannot remember. And that is exactly how the brain loses its memory. Recent things go first. And there might be entire events or conversations or meetings, not just specific details that are forgotten by the person. Like, last week was Chinese New Year, we had reunion dinner. No leh, isn't Chinese New Year like 2 months from now, something like that, or they could be very repetitive, cannot follow conversations, and they have word finding difficulties. And word finding difficulties, how does this come out? So someone could be by nature very articulate, but gradually with time, if you look at them or you listen to them, they start to stumble with finding certain terms. They'll keep pointing at the fridge and say that thing, the one with the food in it, that one, they can't quite grasp what they're trying to say. Then there's also confusion. Are they getting more easily disoriented about the time or date, where they are going, who they're speaking to or interacting with? And then the other thing is misplacing items. Okay, then relating to the function, a person with some early memory issues or clear memory issues, they would start to struggle with tasks they were normally good at, such as not being able to judge. One example is handling money. Let's say you have an older person who normally can go to the groceries. As in this day and age with pay now, pay la, and with credit cards, right? It's a little bit harder to tell, but the older folk, a lot of them still like to use cash. So if someone was able to use cash and get the correct change and suddenly cannot account for the change that they have or spending a lot of money and no explanation where the money is going, that is a warning sign that something is awry. So with this day and age, with our generation using a lot of payless methods of payment, I don't know how well this can apply anymore. We would have to probably look at other means and methods to judge whether a person's judgment is still okay or not. Other things that will come along some memory issues are mood and personality changes. Again, this will happen because as the brain changes, they become more susceptible to emotional difficulties in controlling their temper, for example. So a person might become more irritable and defensive in general, but especially when they're forgetfulness, they deny it. But when it's pointed out to them, they get very angry at you. On the other hand, they might become more anxious or avoidant, like they don't recognize that they can't remember what they're doing. They would just prefer to stay home and not do anything. That's also a possible sign. Or they could be just more withdrawn or depressed, not necessarily crying, but just looking very sad and forlorn more often than before. Now, admittedly, all of this could overlap with an elderly person just having pure depression or anxiety. So again, this alone may not indicate that someone has memory issues. Then the other thing to note is whether something changed recently. I always find that this is a very helpful question to ask family members because it plays a role in understanding why they're bringing a person to come and see me or why these changes might have happened. And if you look for clues along the way, there could be things like a recent bad fall or a recent illness that may have confined them for a period of time with lack of social or environmental stimulation. Retirement, as I mentioned earlier, with one of the many changes that could occur in age in an older person, this can be a major enough change that it can set off issues in a person. Any other environment like move house, move country, this kind of thing. And then the last thing I want to emphasize is how is their hearing? There is very strong evidence to show that if you ensure an older person hears well, hearing aid, that can actually prevent dementia. So please work with your GP or your ENT doctor if you know them to ensure to test the person's hearing. Okay, so now that we have some idea of what to look out for, uh, we have to ask, okay, what can we really do? So that goes to the next part of risk reduction. Ultimately, prevention is better than cure. However, that being said, some things can be changed. Example, genetics. I don't know if you all know. I mean, I followed this story quite closely. What's his name? Chris Hemsworth, who plays Thor in the Marvel movies, very famously went on a documentary to do different things with his life. I don't know what the basis of the documentary was, but there was one episode where he decided to learn about aging, and he was tested in terms of certain genetics to look for Alzheimer's. And unfortunately, he has tested positive for the two genes that mean that he has a very, very high chance of getting Alzheimer's in future. And I believe, if I'm not wrong, his father has actually got the disease by now. But what I read and what I was heartened to read is that despite knowing this, he doesn't treat it as kind of like a death sentence. He doesn't feel all doom and gloom about it. He's actually doing everything he can to ensure that his health and his physical state are good. Because even if you even if you have the genetics, good health will go a long way, better than not doing anything about it. Which leads to my next point. Stay healthy and active. Nutrition is very important. I don't know if people have been following the news lately or lifestyle advice. There's been a lot of talk about increasing how much protein an individual is consuming because it leads to the next part about being able to exercise and do kind of cardiovascular and strength training, especially, again, next thing, for women. to prevent falls and to prevent sarcopenia. Sarcopenia is a condition that is associated with aging, which means muscle loss, and it's a very real thing. And you see it in certain, you see it spike in certain age groups. I can't remember offhand which age. There are spikes like somewhere in the 70s or something like that, and then there's another spike later on. And then additionally for women, this means protecting your bone health. Then the last thing I put there is sleep. I put it in capital letters because sleep is actually very important. As a psychiatrist, if I can't fix anything else, at least let me fix your sleep. It doesn't matter whether you are at risk of dementia or any other thing, sleep properly, all right? And I cannot emphasize this enough because in Singapore, we are all guilty of not sleeping enough. Okay, then the other thing is build up mental resilience and remain cognitively stimulated. So what does this mean? If you read what I put there, it means to engage in hobbies that balance relaxation and mental stimulation and try out something new you've always wanted to. What does this actually mean? I find that a lot of people that I meet, right, they view hobbies as very trivial, but I don't find them trivial at all because it gives you another source of activity that is enjoyable, that helps you relax from a very stressful day at work. But if you are learning in this particular hobby, then all the better because it keeps the brain active and stimulated. And, beyond a certain age, the brain is not very neuroplastic, but it remains a little bit neuroplastic. So lifelong learning is a very real thing, which is why this is very important. Okay, then again, going back to one of the things that happen in aging, which is a smaller social circle, because children grow up, they move out, our friends kind of leave our circles, because they're ill or they pass on. So actually, all the more as we grow older, and for our elderly parents or grandparents, we need to keep up the social network and support, remain connected to people, community, learn to manage feelings of isolation and loneliness, especially with a hobby. I mean, if you really cannot find a social circle, that hobby or that thing is going to be very important. And of course, if you are more extroverted, more keen, group activities is very, very helpful because that interaction helps continue to stimulate one's mind. At the same time, it's important to control chronic conditions and other risk factors. So if you have chronic illnesses or if you know someone with chronic illnesses, I think our generation and even the generation above us, they are better in their perspective towards chronic conditions. So they're no longer the sort where they say that, oh, I don't feel anything wrong with me, so I don't need to take medicine. So I think the chronic condition control, that one is okay. But the other thing to emphasize is stop smoking and minimize alcohol intake. In fact, some of the advice out there when it comes to aging and memory is to actually stop alcohol intake completely. But I know that's not realistic. So that's why I put there minimal alcohol intake. Then at the same time, remember that it is never too late to change. You can reduce your risk at the individual level, and you can also mentally prepare or even verbally have conversations to our older loved ones about all of these things. Again, ultimately, the goal is to maintain an individual's independence for as long as possible. Okay, so then next point is preparation. What can families do to respond with confidence? So a talk like this is helpful. You educate yourself, you find resources. There's actually a lot of stuff available online. And of course, you can ask around for help. The other thing is every country has the same issue, which is that the healthcare system is very complex to navigate. Where do I go? Do I go private, public? How do I ensure my elderly loved one gets their? Do I see a neurologist? Is it a psychiatrist? Do I just see a nurse? Brain scan? Don't brain scan? That kind of, it's all very complicated. I understand that. So just ask around and then educate yourself. The good thing again with a lot of information online, is quite easy to figure out where to go nowadays as opposed to say even 5 years ago, 10 years ago. And in Singapore, there are actually a lot of self-help and support groups to help caregivers the one of the first things that come to mind is Caregiver Alliance, or CAL. They're very active in helping people find support. Then also anticipate. One of the things that I tell families to do is to ensure that their loved one does not fall down. They have to ensure that the living environment is safety proof. Now, bearing in mind that whether or not the person in question listens to this safety advice is a different thing. But at least if you know, you can prevent it, or you can enhance your own safety in future. Then also the daily activities and regular structure, social and community engagement, like I mentioned, as well as anticipate any behavioral issues. So this one, I won't really go into detail, but we know that when someone has memory issues that start to develop into a more dementia-like condition, there can be behavioral issues associated with it, like the person becomes more aggressive, more agitated, they don't understand why they have to stay home or they have to do certain things. And this has to be managed by caregivers, which admittedly is a very stressful thing. And that's why you educate yourself and you get support from various groups or from the various people in your life. Okay, then I think the second part of this, there will be something on LPA, right? So this is also very important. I've often met families where they feel very helpless once someone starts to have memory issues, even though the memory issues are not very bad. And I often tell them, look, it's not the end of things. You can continue to have conversations with the person in question, especially if their memory is still somewhat intact. They can have something, they can express what they want for themselves. So the reality, and even if that person cannot grapple with it, right? At least you remember this for yourself, because end of life issues are a reality. We have to face it. And just because it's taboo doesn't mean you avoid the topic completely. Because what I see a lot of times is, so I treat elderly people, but I also treat adults who are, my age, and they tell me stories of, auntie, uncle, or parent, grandpa, grandma who passed away and did not do estate planning properly. So if anything, if you think about your children, what you should do is plan for yourself. What do you want when that time comes? Then, of course, share the load. Be mindful of caregiver burnout and stress and the need for respite. And I'll go into that more later on. Okay, so I'll touch a little bit on end of life planning. I know someone's going to speak on this later. I found a lot of useful information. There's this website called My Legacy at Life SG. Or you can consult a lawyer. But basically, there are a lot of different things when it comes to end of life planning. There's your will, there's your CPF nomination. That one, I think CPF nomination, I think is the simplest thing you can take care of, because I think nowadays you go online and you click and then done already. LPA, the Office of Public Guardian has also simplified the process, and as Jenny mentioned earlier, the fee for Form 1 is still waived for now. Then there's advanced care planning. All these different things are all part of end of life planning, and basically before you go into the details of all these things, just ask yourself these questions, which will help you to answer where you want the direction of these various things. Like, how do I want to be cared for at the end of life? Who do I want to make the decisions for me, especially if I'm still alive, but if I've lost my mental capacity? Things like funeral, and how do you want your assets to be managed after your death? So again, I understand that culturally, a lot of these questions are very taboo. They're very heavy. They're not nice to talk about. Even if you don't want to talk about it with anybody, at least think about it so that the people around you are not left hanging when something happens. Okay, so as mentioned, I'm going to talk a little bit about caregivers, because to me, this is very important. Again, when I see an elderly person with memory issues, I often don't just treat the elderly person, I'm treating the caregiver too, because they are the ones burdened with looking after the person. So I want to talk a little bit about caregiver stress. It's a very real thing. Caregiver stress exists because an individual or individuals might be in a unique position of juggling multiple roles. They are very often time an adult caring for an elderly parent while juggling a part-time job. At a certain point, a full-time job is no longer realistic, and their children might be school going. Usually not like secondary school or poly, but more university. But still, not income, not drawing an income, and the elderly parent might be mentally unwell, or they might have a vulnerable adult child on top of all these responsibilities. And the sad thing about caregivers is that well, not the sad thing about caregivers, the person being cared for may not recognize the level of help that they need, which adds to the carer's stress. And there was actually a study done by Duke and US way back in 2017. I don't know if they've done anything updated, but these are the stats that I drew from that study. 20% of informal family caregivers in Singapore are above 65, and 5% are actually above the age of 80. So you imagine, right, these caregivers also need care. More than 80% of caregivers aged 65 and above have their own chronic diseases to manage. And despite their own deteriorating health, older caregivers who are well beyond the retirement age spend very long hours providing the care they need to their family members. And furthermore, a significant proportion of these caregivers are providing care all alone without any support from others. So this is something to bear in mind. Because the risk to caregivers is that they have high rates of burnout, depression, and anxiety themselves. Some can experience grief due to the loss of their loved one's potential or former identity, especially in the case of dementia. Caregivers themselves can develop suicidal thoughts of self-harm, and even thoughts of harming the ones they're caring for, which is really, if you think about it, it's really no fault of their own, but that's what happens or what can happen. So therefore, carers need time for themselves and they need support too. Oops. Okay, so actually that comes to the end of my talk. Thank you everyone for listening.